Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show.
Mycophenolate Mofetil. It is isolated from Penicillium stoloniferum. Available in 250 mg capsules, 500 mg tablets, 100 mg per ml oral solutions. Recommended dosage is 2 to 3 grams per day. We have to start with low dose, that is 500 mg OD, then gradually increased until 2 to 3 grams per day. It is rapidly absorbed from the gut, but not rapidly acting. It takes 6 to 8 weeks to show its therapeutic response. It reaches peak within 1 hour. Again, it reaches a second peak within 6 to 12 hours. This second peak after 6 hours is due to enterohepatic circulation. 94% is bioavailable, 97 to 99% is protein bound, that is, it is highly bound to the protein albumin. Whichever the drug which also influences the albumin can influence our mycophenolate mofetil. T-half is 16 to 18 hours, metabolized in liver. First, this pro-drug mycophenolate mofetil MMF gets converted to mycophenolic acid. A for acid, A for active metabolite. What is active metabolite of mycophenolate mofetil? That is mycophenolic acid by enzyme esterases in liver, plasma and in kidney. Then this mycophenolic acid undergoes hepatic glucuronidation to mycophenolic acid glucuronide. Whenever you hear the word glucuronide, it means it is inactive and water soluble product which can be easily excreted via kidneys. Here our mycophenolic acid glucuronide is 90% excreted in urine, rest 10% via bile, that is via gut and feces. This glucuronidation we have already seen while discussing about dapsone. Now 10% of mycophenolic acid glucuronide entered bile and then gut. In gut and even in epidermis, glucuronidase, beta glucuronidase enzyme is in high quantity. This will again break glucuronide. Now if you remove glucuronide, what will be left out? Again mycophenolic acid will be formed. This is the enterohepatic circulation, which is the reason for second peak of mycophenolic acid. Now, what our active metabolite mycophenolic acid will do, we will see. Coming to mechanism of action, it is mainly immunosuppression. Mycophenolic acid selectively inhibits activated lymphocytes without targeting other organs due to its high affinity for the enzyme inosine monophosphate dehydrogenase in these activated lymphocytes. If a drug is highly selective, targeted, it won't target other organs, so that side effects will be less, safety profile will be more. That's why it has a broad therapeutic index. If a drug is having a narrow therapeutic index, we have to be cautiously monitor the serum levels. If in case it exceeds this narrow therapeutic index, it leads to toxicity. That problem is not there with mycophenolic acid because it is highly selective towards our active lymphocytes, activated lymphocytes. Now we can see our mycophenolic acid is inhibiting inosine monophosphate dehydrogenase, which helps in purine synthesis. Now purines are not getting synthesized from inosine monophosphate, leading to immunosuppression. Mycophenolate also leads to downregulation of cell adhesion molecules like VCAM1, E-selectin, P-selectin, thus inhibiting the recruitment of inflammatory cells. It also leads to inhibition of antigen presenting cells, dendritic cells and fibroblasts. Coming to uses of mycophenolate mofetil, FDA approved use is organ transplantation. Off-label uses are immunobullous diseases like pemphigus vulgaris, foliaceus, paraneoplastic pemphigus, bullous pemphigoid, cicatricial pemphigoid. Linear IgA disease, epidermolysis bullosa acquisita. Autoimmune connective tissue diseases like systemic lupus erythematosus, diffuse systemic sclerosis, dermatomyositis. Chronic urticaria, chronic actinic dermatitis, papillosquamous diseases like psoriasis, lichen planus, palm follicles atopic dermatitis, lichen planopilaris, granulomatous disease sarcoidosis, pyoderma gangrenosum, which is a neutrophilic dermatosis. Vasculitis like Churg-Strauss syndrome, granulomatosis with polyangiitis, microscopic polyangiitis. Coming to contraindications, it is a category D drug. That's why it is absolutely contraindicated in pregnancy and lactation. It is a category D drug, not C. Hypersensitivity for any drug, it is an absolute contraindication. Coming to relative contraindications, peptic ulcer disease, live vaccination. Remember, whenever we are giving a immunosuppressant, we have to check for TB. Along with that, we shouldn't give live vaccination. Severe renal impairment, liver impairment, cardiopulmonary impairments. Coming to adverse effects, GI, nausea, vomiting, diarrhea, and abdominal pain. Genitourinary, frequency, urgency, dysuria, hematological, pancytopenia like agranulocytosis, neutropenia, thrombocytopenia. If we give azathioprine also along with our mycophenolate mofetil, both will lead to bone marrow suppression. That is, hematological risk will be increased. Infections, bacterial, mycobacterial, viral and fungal infections, particularly at high dosages of mycophenolate mofetil. Neurological side effects like weakness, fatigue, headache, insomnia. It is a teratogenic drug. That's why absolutely contraindicated in pregnancy. Carcinogenesis is controversial. It leads to mainly lymphoma, B-cell lymphoma, non-Hodgkin's. Drug interactions. These are the list of drugs which reduces the mycophenolate mofetil. Antacids, proton pump inhibitors, which disrupts the enterohepatic circulation. Steroids and cyclosporin, which elevates mycophenolate mofetil. Aspirin, phenytoin, they binds to albumin. Whichever drug binds to albumin will increases the free drug, that is mycophenolate mofetil. Next, azathioprine. If we give azathioprine, what it will do? It will also inhibit bone marrow, further increasing the risk of bone marrow suppression. Coming to investigations and monitoring. CBC, LFT, RFT every 2 weeks. Initially, while we are increasing the dose gradually, after we have reached a stable dosage, we can do 3 months once. SBS, HBsAg, anti-HCV pregnancy testing. After ruling out pregnancy, that is pregnancy test negative, we have to record and then only proceed to give any teratogenic drug. Tuberculin test, MON2 test, purified protein derivative test. All three are same to check TB. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. Das vidania.